This is Healthcare Bill, part number 34, and we're going to talk about this today. This is Section 2704, which was the original Section 2701 we've been talking about in the last couple of videos. This is Title 27 of the Public Health Service Act, and this is page number 10. Now bear with me here. I'm going to scroll down just a bit. And we're going to be talking about this. This is the method of crediting coverage. We were talking about this in the last video. I got a few things wrong, and therefore a YouTube viewer got a hold of me, told me the things I need to correct, and so I'm going to correct it here in this video. Let's just suppose you're a factory worker. Now, I know in modern days there hardly is any factories left in here in the United States. I mean, there are some, but not as many as there used to be. But in the old days, there used to be a lot of factories. Now, let's say you're working at a factory, you've worked there 5 years. You've had medical coverage for 5 years. You had a pre-existing condition. Say you had some heart disease, all right? And this medical coverage was covering your heart disease, and they were giving you medical treatment, that kind of thing. All of a sudden, they had to lay you off temporarily. So they laid you off for 5 months, okay? So now you're paying for all this medical coverage all by yourself because you can't afford to pay for the medical insurance. I know they have the COBRA thing, but I'll tell you what, when you find out what COBRA is like, yeah, you don't buy that coverage. So you're paying for this all by yourself. Now the company hires you back. Okay? The company had you for 5 years. They laid you off for 5 months. Then they hired you back. Okay? Now, you've gotten back on the medical insurance, but now you have a pre-existing condition. Now, let's say you work for 6 months, okay? Now, they're not going to give you credit for 5 years and 6 months for your health coverage because there was a gap of the coverage between the time you were laid off and the time you got back on. That period was 5 months. That 5 months was more than 63 days. Okay, you weren't laid off for 63 days, you were laid off for 5 months. So, now you got a pre-existing condition, and they're still not going to pay for your heart disease until you've had medical coverage for a full year. You say, well, I had all that coverage for 5 years. They don't credit that 5 years. They only credit the 6 months that you've had coverage since you got hired back on. So you've got to wait another 6 months before you get coverage for that heart disease, despite the fact that you had 5 years of coverage before your layoffs. Okay? Alright, now they have an election of alternative method. Now, sometimes companies are really nice, okay? So what they do is they divide up the coverage benefits into, hang on just a second, into 5 categories. Mental health, substance abuse, prescription drugs, dental care, and vision care. Okay? Now, that means that if they really wanted to be nice, they may, when you get hired back on, they may automatically cover you for your vision and dental. Say, well, you know what, there's not going to be a pre-existing condition for those two. So, we've hired you back, we're going to cover your vision and dental right away, but because you're heart disease, you have to wait a year before we cover that. So you're still paying out the nose for this heart disease medication, and you have to wait another 6 months before they pay that, because it's now considered a pre-existing condition, even though you had medical coverage for 5 straight years. Remember, you got laid off for 5 months, so your medical coverage stopped. And that's what that means. So, to go through it one more time, you worked 5 years, you got laid off 5 months, you got hired back on, but they only credit the 6 months towards your pre-existing condition, and you have to wait another 6 months in order to get coverage for your heart disease again. So you're going to be out of coverage for your heart disease a full year and 5 months, even though you had medical coverage for 5 years before you're laid off. Isn't that nice? Okay. So anyway, there you go. Alright. I'm going to cover the rest of this in just a little bit, so stay tuned.